Hello, today we'll be showing you how to get a venous puncture to get a blood sample. I'll be showing you your materials today. You will need gloves, no blood. You will need gauze, you will need alcohol, you will need tape, you will need a needle, vacuum containers to hold your blood samples, a vacuum container holder, a tourniquet, and your stuff. Perform hand hygiene and put on personal equipment. Identify your patient and explain your procedure to your patient.
Hello, my name is Ashley and I'll be your student nurse today. Today we'll be doing a venipuncture. I'll be checking for a palpable vein.
Check the specimen label with the patient's identification. Label should include the patient's name, the identification number, time specimen was collected, route of the collection, identification of the person obtaining the sample, and any other information required by the facility.
So I'm checking with the name band and the label and the patient.
Make sure all your equipment is on the oversight table within your reach. Close curtain around the bed to provide privacy. Make sure that the lighting is good. Assist your patient to a comfortable position, either sitting or laying down. Determine the patient's preferred site for the procedure based on his or her previous experience.
So we're going to go ahead and take this site because you said it was comfortable before.
Apply the tourniquet to your upper arm on the chosen side, appropriate 3 to 4 inches above your puncture site. Inspect your vein and palpation to determine your best puncture site. Release the tourniquet. Attach the needle to the vacuum container device. Clean your patient's site at puncture site with alcohol. If they're allergic, use something else. After waiting for alcohol to completely dry, reapply your tourniquet 3 to 4 inches above the puncture site.
What are you thinking, a wound care? Things that are restored? Well, it depends too what it is.
On a live patient, you will hold your patient's arm downward position with your non-dominant hand. Align the needle and the vacuum container device with the chosen vein, holding the vacuum container and needle with your dominant hand. Use your thumb or first finger of your dominant hand to apply pressure and traction to the skin just below the identified puncture site to reduce the chances of a vein rolling. Inform the patient they're going to feel a pinch when entering. Grasp the vacuum container securely and stabilize it with the vein. Push it in to collect your first collection. You may remove your tourniquet as soon as blood flows adequately. Fill all your containers until the vacuum doesn't suck no more. After all your labs were drawn, after all your labs that are drawn, remove the last collection tube from the vacuum container. Make sure to apply name the little thingies, the identifications onto each of the things. Make sure you apply at least 2 to 3 minutes of pressure onto the puncture site or until the bleeding stops. When bleeding has stopped, apply an adhesive bandage, or if you don't have an adhesive bandage, roll up gauze and apply tape tightly so that bleeding stops. Remind patient to only keep this on for 15 minutes.
Only keep this on for 15 minutes and take it off after that. Because if you leave it on, it'll cause worse bruising and you'll have more pain with it, okay? Any other questions? Okay. Arm's good.
Discard any needles in the sharp container and remove gloves. Perform hygiene. Do safety procedures with patients, and you are done.
Yay!
Good job.